Your first mental health nursing placement is exciting, but let's be honest, it can also feel overwhelming. New faces, new environments, and the pressure to prove yourself. But don't worry, I've got you covered. In this video, I'll share exactly how to prepare for your first placement and give you my best tips to survive and thrive in your new role. By the end, you'll feel confident and ready to step onto the ward or into the community. So let's dive in. Before we begin, don't forget to subscribe and hit that notification bell so you don't miss any valuable content to help you on your nursing journey. First things first. What actually happens on placement? Depending on your university and trust, you might be placed in different mental health settings, including inpatient mental health wards, where patients stay for treatment, community mental health teams, supporting people in their homes, crisis and home treatment teams, helping those at risk of hospital admission, and forensic mental health units, working with patients in the criminal justice system. Each setting has its own challenges, but the goal is the same: to support patients in their recovery and improve their well-being. Now let's talk preparation. A few things you should do before your placement starts. Read up on your placement area, find out where you're going, what kind of patients you'll be working with, and what the team's role is. If you can, reach out to your practice assessor or previous students to get some insights. Revise key mental health conditions and medications. You don't need to know everything, but having a basic understanding of schizophrenia, depression, bipolar disorder, and anxiety will help you feel more prepared. Also, look up commonly used medications like antidepressants, antipsychotics, and mood stabilizers. Pack your essentials. Make sure you have a small notebook, a pen, comfortable shoes, a fob watch, and your student ID badge. Trust me, you'll be taking a lot of notes. All right, you've made it to your first day. Now what? Here's how to make a great impression and ease into your role. Introduce yourself with confidence. It's normal to feel nervous, but remember, everyone knows you're a student. Just say, "Hi, I'm your name, the student nurse on placement. I'm excited to be here and keen to learn." This makes you approachable and shows enthusiasm. Find your supervisor or mentor. You'll be assigned a practice assessor or practice supervisor. This is the person who will guide you through placement. Get to know them early on, ask what they expect from you, and schedule regular catch-ups. Observe and listen before jumping in. In the first few days, focus on observing how the team works, how nurses communicate with patients, and how interventions are carried out. Take notes and ask questions. It shows you're eager to learn. Don't be afraid to ask questions. You're not expected to know everything. If you're unsure about a procedure, a medication, or even a patient's diagnosis, just ask. It's better to ask than to assume. Placement isn't always smooth sailing. You'll face challenges, but here's how to handle them like a pro. Dealing with difficult patients. Some patients may be aggressive, withdrawn, or unwilling to engage. Stay calm, use therapeutic communication techniques, and always ask your mentor for advice. Feeling overwhelmed? Take a breath. There will be days when you feel like you don't know anything. That's completely normal. Remind yourself, you're here to learn, not to be perfect. Take things one step at a time, balancing placement and studies. Make time to reflect on what you've learned and relate it back to your coursework. Keep a journal of key experiences. You'll thank yourself when it's time to write up your reflections. This is your chance to gain real-world experience, so make it count. Volunteer for learning opportunities. If there's a chance to observe a mental health assessment, administer medication, or shadow a specialist, take it. The more you engage, the more you'll learn. Get feedback and reflect. Ask your supervisor for feedback regularly. What are you doing well? What could you improve? Reflection is key to becoming a great nurse. Network and build relationships. The people you meet on placement, nurses, doctors, occupational therapists, could become valuable connections when you qualify. Be professional, be approachable, and learn from everyone around you. And that's it. Your complete guide to surviving your first mental health nursing placement. Remember, be prepared, stay curious, and don't be afraid to ask for help. You've got this. If you found this helpful, give this video a like and comment below. What's your biggest worry about placement? I'd love to hear your thoughts. And don't forget to subscribe and hit the notification bell so you don't miss my next video. Thanks for watching, and I'll see you in the next one.